So the next is the assessment of the skin of the newborn. So newborn may be appear the ruddy because kay nipis pa iyang tihin. So the thin layer of her or his skin is the entrance of their blood circulation spot is visible. So erythema toxicum newborn na. So mojo na ang mostly na kanang problem sa newborn. So, ang causes sa erythema toxicum it is due to an infections of infections even though per spot exposure are present and has been including the possibility of that the normal effect is baby in immune system, but don't worry of that guys because is from for few days is mawala na siya. So the next is the toddler and the preschool and school age. So many children this age have minor lesions from mosquito bites, from flea bites, if any on plates. So as you can see here, mo ni mga allergies sa children, kanang mga pinaakan sa lamok. So they also typically have a number of ecchymosis spots on their lower extremities from bumping into object during active play. So as you can see here, na siya ecchymosis spot during sa iyahang active play. So I think na nakaagitaan ni during sa atong adolescence ay preschool stage. So maka example ay ikanang makabangga ta og mga something na butang na pwede maka cause og kanang ecchymosis spot sa atohang body. So as you can see is kanang lagom siya. So the causes of that is ang ecchymosis is occurs the blood from a broken capillary that into surrounding tissue within the skin, which is causes discoloration. So muna siya is naglagom. So the next is the adolescence. At least a few acne lesions or on the face or are usually present in adolescence. So as you can see in the pictures na mga acne siya. So naapoy possible na kanang causes sa iyahang acne is kanang nagagamit siya og mga cream, nagagamit siya og mga cosmetics na pwede maka-cause sa iyahang mga acne problem. So as you can see sa look carefully the child tattoo or piercing that assess the site. So as you can see kanang pagtan-aw niya na mas siyang air is kanang wala na unsa sa gawas, but in the presence or pag-abot sa few days or sa sulod di ito is nagka-infection na siya. For inflammations to be certain, an infection is not present. So for look carefully the moles. So as you can see, the moles here is kanang ang most is first is kanang dili pa siya dark brown, pero pag abot sa mga few months or few weeks is kanang naanay changes ang moles. So dapat is gina-assess din nato na sila ang atong mga moles kay so probably in a recent uneven borders or have changes that shape sa ilang shape nice changes sa shape sa signs of melanoma or skin cancer. So magka-cause of melanoma cancer ang moles. So the next is the assessment of head. So the assessment of head of infant is in a newborn is shows a molding elongated shape due to pressures against the cervix before birth, a capsulocydium or cephalohematoma from the pressures of birth may be present. So the causes of this is kinang back sleeping for infants, and many infants have flat occiput, which is plagiocephaly, that infants should start with tummy time. So you can advise that parents that increase frequency of hair washing. So like scalp of commonly encountered in infants of seborrhea, kaling greasy appearing salmon colored patches. So as you can see here na ay sa head sa baby is na ay mga patches ay sevoria. So so again ang cephalohematoma is ang causes is ruptures of blood vessels that cross the peritoneum due to pressures sa fetal head during birth. So pressures and skull is of fetus or a vacuum of into the body fluid. So the causes of sevoria is, I think, that the overproduction of the baby oil producing in the into the sebaceous gland, or the type of oil that contribute to the baby conditions that glands in the scalp of the baby. So don't worry of that, guys, because you should advise the parents of the baby that increasingly the frequency is of hair is you should wash the hair once a day, and also applying baby oil on the scalp typically reduces this problem. So for the toddler is the preschool and school age is examine the hair of 4 children who attend school age daycare for most small white yellow sand size or particles attached on the hair strands, which are the eggs of pedicula. So mga lusa or mga kuto, as you can see in the picture. So maklaro na to na siya. So the causes of that is kanang spread in kanang naga-share og comb, naga-share og towel. So like fungal infection, so can easily spread among school age is a prescription medications that so over-the-counter medications in prescription medications for available pediculus. So the next is for the adolescents. So inspect to see the hair scalp of hair are healthy underneath. The styling tight cornrows and waves can cause hair to break, resulting in areas of baldness. So as you can see, the causes of this kanang mostly sa mga kuan karon sa mga dili lang sa kababaihan, pati sa men is kanang nagagamit naman gud sila og gel, mga hair extension, hair curly hair. So the causes of that is kanang naay possibly na kanang sa sigig gamit nimo ana or sa sigig use nimo ana is kanang nay probably na maupaw ka. So the next is the assessment of the eyes. So the assessment of the eyes is observes eyes of symmetry as signs of readiness, erythema, frequent blinking, and crysting, squinting, and rubbing, because there are signs of conjunctivitis or infections. So magkakause of conjunctivitis or sore eyes or infections sa conjunctiva covering the eye globe. So as you can see here, so for the newborn and infant, newborn often have small bright red spot on the sclera. Conjunctival hemorrhage because the pressure of birth captured a small conjunctivine vessel. So as you can see na ay red spot ang iyang eyes. So when assessing for a red reflex is especially important in a newborn that because of congenital cataract can lead a loss of central visions of not discovered early. So again, dapat ang newborn i-assess na o dayon na dayon iyang result during 24 hours para ma-assess nato for the eyes. So i-assess nato ang iyang eyes kay basing na ay congenital cataract draa. So dapat i-check nato na siya para kay kung di man gud na siya ma-check or madali can cause na loss of central vision or di na siya kita or mahanap na iyang pananaw. So dapat i-discover nato na siya as a health worker, i-discover nato na siya earlier. So in the toddler and preschool, most young children is explaining what is during an eye examination is important to reduce the child anxiety about this part of assessment. So the school age of child adolescent, so many older children wear contact lenses and reflexes is visible in contact in place. So many adolescents is kanang nagagamit na og mga contact lens. That's why muna magka-cause og kanang problem sa eyes. So about about having their eyes examined because they know should be wearing prescribed eyeglasses. So dapat i-assess para ma-provide na o ma-assess dahil na to siya, tagaan dahil na to sila prescribed na eyeglasses, but not wearing because they do not like appearance. So many girls are, so kasagaran sa atong makitaan kanang example is kana luspad ang iyahang diriya, so can cause for the girls for anemic and to have a pale conjunctiva. So as you can see here, if ang tao is nagagamit, adolescents is nagagamit og drugs, so ingana jud ang iyahang eyes kanang more siyang luya. So the next is the assessment of the nose, that observe nose of flaring on the nostrils as signs of need oxygen. Using the stethoscope light, observe the mucous membrane of the nose or the color, it should be pink, suggests infections, pale suggests allergies, and redness suggests infection. So we need to use, as a healthcare provider, we need to use to assess, we need to use stethoscope when assessing the nose to know if naabay problem sa nose because or mga allergies and redness na nagka-cause of infections. So the next is the newborn, and assessing on the nose of the infants are obligate that they breath, they cannot coordinate mouth breathing, so they become disturbed when the nose is temporarily blocked to check the patient's momentality, avoiding discomfort. So for the newborn, kanang syempre kung naay problema sa iyang nose kay naay naka-block, so probably kung maginhawa siya or malisod siya ginhawa, so ang ginhawa niya is maagi na lang sa ihang mouth. So for the older children, many children preschool age and older have upper respiratory infections that causes reading the nasal mucus and purulent discharge. So for the children is maglisod japon sila og ginhawa because na infection sa ilahang nose membrane or the mucous membrane. So the assessment of the ears, observe ears, proper alignment, average child in a lie drone from the inner canthus and then to ear will touch the top of pinna of the ear. So murag na demo naman nato na no kung unsaon on how to assess the ear. So dili na nako na siya i-explain more pa. So the newborn and infant, many newborns still have amniotic fluid or vernictisora, their canal or expecting in air canal reflex and effective. So for the older is middle ear infections, otitis media, that common childhood illness that causes the air to be painful, and examine the external air infections of often called swimmers are causes and any movements of the pinna to be painful. So the next is the assessment of the mouth. So assessment of the mouth. So assess the external appearance of the list for symmetry and color. So ang geographic tongue is a term that through appearing tongue surface that often accompanies in general symptoms of illness such as fever or also normally. So ang geographic tongue is magka-cause the causes of this is kanang magka-cause ni siya illness of fever. So sa mouth is dapat i-assess nato or count the number of teeth to prevent and assess their conditions. Example, ang missing na numbers sa cavities and also the tenderness, the cavities present. So inspect the gum if the gum is nabay number na missing of cavities and edema or kananabay mga hubag-hubag or symptoms of periodontal disease. Inspect the buccal edema membrane and palate for color of example is pink. So the next is the newborn and infant assessment of mouth. So many newborn have considerable mucus in their mouths because they are less able to handle swallowing due to immature muscles and coordination. So when we assessing the newborn mouth, so this assess for white patches and also that do not scrape away from the buccal membrane or tongue. So, pasag din lang na siya. So, ang common but abnormal finding in infants that is requires antifungal therapy. So, white patches that scrape is usually caused by accumulations of formula gut. It's because magkakos ang white patches ang baby because sa breast milk or formula sa iyang inahan. Breast milk or formula na ginainom niya. So, the older child tonsillar tissue in children reaches its maximum growth the earliest school age, making may preschool children appear to be all tonsils as long as the tissue does not appear ridden or tender. You can assume it to be normal of the age. So for a child is orthodontic appliances such as braces carefully. So, mostly sa kasagaran sa mga children karon is sa mga children karon is kanang naga-use naman sila og kanang mga braces. So, you need to assess carefully for pinpoint ulcers and also the gum line sa gum, i-check na to siya, and also the wires not causing undue discomfort or infection. So, cavities appear dark brown areas on the tooth in a male. So, many school-age adolescents have least of 1% and will need dental. Dapat moadto na sa dentist for referral or nabay mga medications na ihatag sa child. So, the next is assessment of neck. Assessment of the neck is symmetry. The trachea should be in the midline. Any division such as lung or thyroid pathology, observe the outline of thyroid of obscured by sternocleidomastoid muscles on the anterior neck to be certain is not swollen or tender. So, probably kung naay problem ang ato ang neck, so, syempre, maglisod ta og tulon sa laway, maglisod tag inom og tubig, or maglisod tag kaon. So, for the assessment of a newborn, so always assess the ability to control the head by lying and fast supine. So, sa pag-assess is dapat nakalaying supine positions and pulling the child to a sitting position. So, babies younger 4 months of age will be heads that lag background and pull up this way, and they will right heads only as they reach a setting position. So, for the adolescents, be certain to palpate the thyroid gland. For, as you can see here, is ipalpate nato. So, sa pag-assess is palpate nato ang symmetry of the neck of the adolescents and possible nodes to do have adolescents tilt and head slightly forward and pressed and on the right side of gland. So the next is the assessment of chest. So, the assessment of chest is for ease of specific location. Chest is pathology that the chest is divided into sections of imagery lines drawn through the mid-clavicle, the mid-mari, and mid-sternum and points of the front. So, sa chest is i-assess na to ang proportion. So, sa antero-posterior or the lateral diameter. So the pathology that describe of term of this line such as abdominal lung and lung heard at left mid-axillary line. So, helpful means of locating the pathology in the intercostal spaces. So, assessment of the breast. So, for the newborn is both male and female newborns maybe have breast edema from the influences of bimaternal hormones. So, for the newborn, so as you can see in the picture na murag ning tubo gamay sa newborn, kanang nihubag gamay ang tutoy. So, don't worry about that the causes of that is from influence of maternal hormones. So, this is normal and fade. This is very normal. So, ayaw lang jud siya hilabti because do not ayaw siya kumuta or squeeze or to remove the. So, ang kuan ani niya is document of supernormal nipple in presence sa baseline data. So, natural lang na siya is mawala lang na pagka few days. So, the next is the school-age adolescents. So, in school-age adolescents, to do a breast examinations on all girls past puberty. If a girl younger 8 years is beginning breast development, precious puberty, kanang if naanay kanang mutubo na ang tutoy sa girls, is muna gitawag og kanang precious puberty should be suspected often of breast as start to develop before the others. So young girls are starting development tissue of discomfort. So sa mga kana may edad is wa pa man naanad, so magka feel sila og discomfort and develop ang breast. So many dili lang pud ang babae is probably muda ko ang breast. So na many pre-adolescents of developing hypertrophy of breast tissue due to increase ang due to hormonal influences. So gynecomastia, such boys maybe unsa man maybe reassurance that will normal for the age and will fade as soon as kung magkuan na change na ang iyang androgen becomes their kanang dominant hormone na siya. So inspect the breast tissue is yes if the child sits on the examining. So the next is